Good day, friends of Buzzy. I am alone in my office, so I am maskless today. Start to feel a little bit naked without my mask. We are going to talk about the issues with long-haul syndrome. One of the biggest questions my kids had when they weren't sure if they got COVID or not. Everybody tested negative. Thank you for asking. But one of the biggest questions was, how do I know if this is going to keep going? What's going to happen if I've got a sore throat and it lasts for a week? Does that mean that this is likely to be COVID long haul syndrome? So I'm going to answer questions about that today. We have talked a lot about the issues with myocarditis. We've talked about some of the ways in which the SARS-CoV-2 virus attacks different tissues in the body on some of the other podcasts or videos. But today I'm going to go over some new data on what the likelihood is of long-haul symptoms from COVID-19. A new study just came out October 7th in preprint, which, as you know, means that it's not yet accepted for publication, but this one looks like it's going to be a good one, and the peer review that I've done supports what their findings were. What they found was that in a group of about 240 patients with COVID-19 compared to 22,000 patients who did not have COVID-19, so they could really see, is this just that you got it and so you're scared, or what's it like for other people who got other diseases? What they found was that about 46.1% had symptoms from COVID-19 that persisted past 30 days. That's kind of scary. The overriding thoughts about long-haul syndrome is that about 10% of people are going to have symptoms that interfere with their daily living. Now, what this study found was the most common symptoms that persisted were things like not being able to smell or taste, which could last longer than 30 days. But the ones that are the most concerning and are causing people the most problems are very similar to symptoms from chronic fatigue syndrome. One of the interesting debates that's going on is whether or not patients with chronic fatigue syndrome are probably having a post-viral syndrome that's lasting for months, which has been blown off as psychological or as hysteria, or people who just didn't want to get up because they're depressed. But now that doctors and healthcare workers are having the same exact kind of symptoms as those with chronic fatigue, the idea is growing that this may be an autoimmune response to a virus. Because COVID-19 spreads through so many different organs, and because the ACE2 receptors are so widely spread, the thought is that maybe this is the same reaction that people with chronic fatigue syndrome are having. It's just attacking the places that the COVID vaccine does. All right, so if you've had coronavirus and you're like, are these things I'm feeling a chronic long-haul system? So the ones who are most likely to develop long-haul syndrome symptoms are the people who've had COVID the most severely. So people who had hospitalization, certainly the people who had real difficulty breathing. So the ones who had an initial symptom of shortness of breath, that particular symptom is very specifically linked to likelihood of long-haul syndrome. Dizziness, brain fog, confusion, inability to concentrate. Those are probably the most common constellation that are particularly associated with COVID-19. Heart palpitations, myocarditis, the feeling of getting tired very easily, fatigued walking upstairs, that is another severe symptom of long-haul syndrome that is kind of specific to COVID-19. General body aches, fatigue, and weakness, and needing to sleep all the time, that goes along with the general chronic fatigue syndrome. So there may be some overlap, but certainly the best guess right now is that the immune system continues to act abnormally after COVID-19 in the same way that it acts abnormally, causing the severe after effects of it. So a couple other interesting things. The number of people who had prolonged symptoms who had mild illness was 14.3%. So if patients who were close to asymptomatic or mild, they noticed confusion, brain fog, things like that in about 14.3% of cases. One thing that has recently been published is that the antibodies do seem like they're fading between 4 and 6 months. So it may be that these long-haul syndrome patients only have symptoms for the same duration that the COVID antibodies stick around. Most coronaviruses, the common cold viruses, don't give you lifelong or even prolonged immunity. You're only immune to a common cold for about 4 to 6 months. So we're seeing that same kind of behavior with the antibodies in coronavirus. Hope is that just as the antibodies don't stick around long, maybe the long haul syndrome will only be as long as those antibodies are still in circulation, attacking the ACE2 receptors and causing this strange reaction of prolonged symptoms. That's about all we've got right now for the long haul syndrome, except that there are definitely multiple groups online and Facebook groups that have formed. If you Google long haul and Facebook, you will find support groups for people that have these symptoms and want to be believed and want to be involved as soon as we get clinical trials to try to address where some of these symptoms are coming from. I do believe that the long-term outlook of this is going to be good because I think there are going to be enough people who have these issues, particularly with the myocarditis, the heart inflammation, and the concentration impacts, that will start doing some sort of autoimmune treatment, immunoglobulins, antibodies against the antibodies. But I think that the good news is that enough people will be suffering from this, that the likelihood of science turning its focus onto how to help the people long term and finding a cure for that will be the next big thing after we get the symptoms of the disease itself under control. Because long haul symptoms are less likely when the disease itself is less severe, there's a good chance that the variolation, the fact that people wearing masks end up not being as sick, that will decrease the likelihood of having long haul syndrome. So one last thing that I want to end with that is sort of related to how do you protect yourself from long haul syndrome. So I want to show you this diagram, which shows how mask wearing by state is related to number of coronavirus cases. So it clearly shows that the states where people wear masks less, they have more cases. Where they wear masks more, they have fewer cases. So it's not just to try to keep yourself from getting coronavirus. It's also that if you wear a mask, you're less likely to get a severe case, which means you'll be less likely to have the long haul syndrome. All of our videos talk about the safety, the variolation, the why masks work, the where the virus enters, how to decrease the severity, nasal irrigation, my favorite thing. And please check those out if you've got any questions about any of the other things that we've talked about today. I will be back after I review next week's early pre-press prints and tell you the newest, hottest, and most hopeful about COVID-19. It's still scary, but it's going to be fine.